Hi, I'm Dr. Gautam Bhaumik. I'm a general surgeon with a special interest in proctology, especially laser proctology. I'm based at Manipal Hospital Salt Lake, Kolkata. Now, one of our predominant problems which we face from day to day is uh, bowel problems or sometimes rectal problems. We can have a bit of bleeding from the bottom or some itchy sensation or burning after moving bowels. Now, frequently and unfortunately, this is something which is brushed under the carpet. This is something for which we do not seek medical help, and that is very unfortunate. A proprietary medicine bought across the counter, or a bit of an advice from a friend who's been through this problem, is probably not the right way to go. Not all rectal problems are piles, and our bottom is the last place in the world you'd like to show to others, and it's certainly something which we don't see. So you got to remember that when you have a rectal problem like bleeding, you should not be the consultant dealing with it. Go to your GP or to a general surgeon, or preferably someone who's a specialist in it. He will do a gentle examination of the rectum, which is essentially without any discomfort if done properly, and he will diagnose the problem. Need be, he'll do some investigations. If not, he'll just give you medicines. You'll be quite all right with it. About 5 to 10% of rectal problems need surgery. So do not shy away from treating the disease thinking that it will need surgery. Surgery, in fact, is, if you ask me, is one of the last options for rectal problems. Majority are treated quite easily conservatively. Special attention to the diet, avoiding red meat, plenty of water, vegetable, restful life, and maybe sitting in a tub of hot water will help you. But do not apply proprietary medicines, because many of these contain steroids, which may not be the right thing for you. Sometimes you may need a small camera test of your bottom, which goes by the name of scopy. It can be a scopy of the rectum, called a proctoscopy, or a scopy of the sigmoid colon, called a sigmoidoscopy, or even of the colon. Whatever it is, you've got to leave it to the specialist to decide what you need to have done. Remember that whatever is said in Google is not always correct. Piles, as well in lay terms, is basically a cushion of blood vessels which can leak and bleed from time to time. Usually, piles bleeding is painless, but it can be painful if the piles becomes thrombosed or prolapsed or even gangrenous. A fissure is a cut in the bottom. It may be cut because of a hard stool, and that can cause pain and sometimes bleeding. A fistula, on the other hand, is an abnormal tract which carries infection from inside the rectum to the outside. These are the broad three problems you can have. You can also have adenomas in the rectum. You can have few other major diseases. I wouldn't bother you about these. But the take-home message is, if you have a rectal problem, seek attention at the earliest opportunity.